Anna has rheumatoid arthritis. Like most patients with a chronic condition, the majority of her life happens between appointments. That's where the signals appear, and where the care team has no visibility. This is the gap her hospital set out to close, with an agent built on BlueNexus. She opens Ada, her rheumatoid arthritis assistant, and signs in. Access is encrypted and scoped to her. Her data stays hers. Setup begins by connecting her data sources. Anna starts with Apple Health. She scans the code and installs the app on her phone, which links her Apple Health to BlueNexus. Then her hospital record through Epic on FHIR, and her own files from her Google Drive. Each connection is scoped to exactly what the agent needs, nothing beyond that. The platform supports a growing library of health connectors. Oracle Health, Withings, Polar, with Garmin, Fitbit, and others in progress. If a hospital or a patient needs one that isn't available yet, it can be requested and added. The agent asks Anna a few simple questions. She answers in plain language and points it at the files she's connected. From that, the agent sets everything up. Her diagnosis, medications, and notes pulled from her record. Then it offers to learn her personal baseline, and Anna gives the go-ahead. From her own history, it sets her normal across sleep, activity, and heart rate. So from here on, everything's measured against it. Each morning, the agent checks in. It looks at how she slept and moved, then asks what the data can't capture, how she feels. And every observation is traceable, drawn from her real connected data with the source shown. This morning, Anna reports some stiffness and mild knee pain, about 4 out of 10. The agent weighs it against her baseline. It logs it, suggests a couple of things that help, and keeps watching. Only a lasting change reaches her care team with a clear summary. Anna asks for a dashboard of her week, her steps, her sleep, her pain, and what to focus on. The agent builds it in seconds. Everything here is measured against her own normal, her personal range, her steps day by day, her sleep as the baseline continues to build, her pain from her daily check-ins, and then what to focus on. Clear priorities for the week ahead. Anna asks it to go further, across the whole quarter, April to July. At a glance, the cards tell the story. Everything side by side. Watch how her pain and stiffness rise together through May into early June, while her steps and sleep fall at the same time. As the flare eases, all four move back toward her normal, zoom into pain and stiffness alone, and hover any day to see the exact reading behind it. And in plain words, the agent sums up the whole quarter, the flare in June, and the recovery through July. And to make all of this repeatable, there are workflows. Common tasks saved as a single command. The hospital can build its own, and patients can use the ones already there. Anna runs her weekly summary, and in seconds, it's ready. And any of it can be exported and shared. A clean report for her care team, in a tap. Anna asks Ada to summarize how she's been doing. For her doctor, Ada writes a clean progress note, ready to share. Then Anna asks to email it on. And Ada stops. The address doesn't look like a clinician's, and this note carries sensitive health data. So it confirms the recipient first, and only sends to an approved contact. That's a guardrail, doing its job. Now the clinical side. Signed in on the hospital's own account, the care team sees what the agent has been collecting. Anna's daily records, saved to a database only they can access. So a doctor can see how their patients are doing between visits, as it happens, without waiting for the next appointment. Real data, real patients, one agent that brings it all together, built without code, deployed in days. This is BlueNexus, BlueNexus.ai.